we are excited today to introduce our very first guest, Dr. Gugu Nhleko, who is an expert on TB and who's very passionate about TB issues. Doctor, you are welcome on Philanami Foundation podcast. Please introduce yourself and tell our viewers about yourself.
Thank you so much for having me. My name is, like you mentioned, Dr. Gugu Nhleko. My parents decided to give me a whole lot of names.
Yes.
I'm a mother, I'm a wife, I'm a doctor. So I currently work for a non-governmental organization that deals with TB diagnosis, management, and retention in care, because all of this that we're trying to do, we're trying to end TB or eliminate TB. Where does my passion for TB come from? I think everyone has a TB story. So before I'm a doctor, like I said, I'm someone's wife, I'm someone's mother, I'm someone's child, I'm someone's granddaughter. I myself have lost family members to this disease. But really where my passion comes from was when I became a community service doctor working in a rural area, and I worked in a male ward, and I saw a lot of TB. I saw a lot of TB in the wards. I saw a lot of HIV. And I think what made me sad was how neglected those patients were, how discriminated those patients were. And I think that's what really inspired me to always strive to do better for those patients who are usually marginalized. So that's where it really comes from.
Okay, doctor, from your experience and from everything that you have seen about TB, what can you say to somebody like Abugelago right now? What is the main challenge that you normally see when it comes to TB patients?
The biggest challenge that I've seen is stigma and discrimination. And unfortunately, TB is a disease that spreads, it's contagious. So people, you just have to breathe it in, and no one can stop breathing so that they don't get it. But ngendlela esisaba ngayo, it's like only particular people can get it. But kahle kahle, anyone can get it, whether you're young, whether you're old, whether you have HIV or you don't have HIV, anyone can get it. And I think once we are able to raise community awareness and people actually understand the disease better, that's the only time we can say we will be moving towards eliminating TB. But I think right now, definitely the biggest setback is the stigma and discrimination. And also just looking at the fact that TB is a social disease. So issues of poverty, of which in our country, that's a problem. So overcrowding, poverty, those are all things that contribute towards the disease burden. And I think once we can address those things, then we'll definitely start moving somewhere.
You've mentioned that you've been a community worker. As a doctor now, what would you like to see happening as Dr. Gugu Nhleko?
What I would like to see, I think at a community level, I think I would love for people to be more aware of TB, because sometimes you find that people are dying of TB not because there's no cure. There's a cure, but people are presenting to healthcare facilities too late. And I think once we can raise that community awareness, but also just to address issues of stigma, to address issues of discrimination. Kunabantu who get diagnosed with TB angafuni ukudisclose emsebentini because ubona ukuthi ngingasho batongixosha. Or if I tell people I have TB, no one will want to sit next to me. But people don't understand that TB is literally everywhere.
Okay, doctor, you have mentioned and unpacked the things that you would love to see happening in our community. But for someone who doesn't really know or who is not really interested, and what is this TB? Can you please unpack what is TB?
That's a very good question. I think we always keep saying TB, who's low TB, no one really knows. So TB is actually short for tuberculosis, which is the name of the bacteria or the germ that causes the disease TB. So it's a bacteria that is in the air. So if umuntu enalo leli gciwane leli and they breathe or they cough or they talk or they sneeze or they sing, literally anything ekhipha umoya ngamakhala or ngomlomo, so that will then expel le germ ukuthi ibe in the air, and anyone who's in the vicinity can then inhale leo bacteria leo, and once you inhale it, it goes into your lungs, and so that's why usually abantu will then have symptoms that are coming from the lungs, because that's where the disease usually starts. But sometimes it will then go into your blood and it can affect any part of your body, so from your brain to your bones to your lymph nodes, or what we call glands. It can affect any part of your body.
How does one get TB?
Okay, so like I mentioned, Uguti, TB is in the air. So from someone who has the infection, be expelled in the air, and whoever's in that vicinity then can breathe it in. However, it's also dependent on the person that is breathing it in, especially if immune system is compromised. So especially if you're looking at elderly people, so abantu abadala kakhulu, like abantwana, because their immune systems are not strong. People with diabetes, because their immune systems are not strong. Someone maybe who has cancer, who's on chemotherapy, immune system is not strong. Someone who has HIV. So any condition cause immune system inga be strong. Even stress and not eating well, if your immune system is not strong, then that predisposes you. If we inhale ale bacteria, then ube nale disease. However, for a healthy person who's got a very strong immune system, they can inhale the bacteria, but immune system destroy, and then
Okay, I want to share about me. With me, I remember the first time I had TB, Besiegu camp, church camp, one of the places, Letizia Highveld, and I'm from Lowveld. So it was very cold, and we were not prepared that we should bring enough blankets. And you had in youth camp, nilala a hall, some of the blankets on the floor, and then I think I'm getting my cut because being kwehlela, sweating and all, and then there was fluid in my lungs that was drained after I got admitted in hospital. How does one, or the people who get to be but also the fluid, you will say it with your medical term, go see what is that fluid called, but demand. So I think I remember when I was Mabang test, they were checking if I have pneumonia or TB. So what is that I had the first time I got TB?
Okay, so what you had the first time you had TB is what we call pleural effusion. So basically it means there's a collection of fluid between the covering. There's two layers that cover your lungs. So when you have fluid accumulate then that can we call it pleural effusion. So basically so when you inhale le TB iyahlala in your lungs, and then ingakhoza infection ehleli just in your lungs, right? But sometimes it's all then it goes into your blood, and remember your blood flows everywhere. Akukho la where you don't have blood, whether it's your skin, everywhere. You literally have blood vessels everywhere. So sometimes it's all TB lena, then through your blood system will go into different parts of your body, like that covering, and then may figure out how when it causes infection lapo, the immune response will then cause lamante to accumulate.
TB, we all know ukuthi ichazwa njenge silent killer. And we've seen many people dying of TB. Even during COVID, when we check on the stats, it shows kuti many people were not killed by COVID but TB. How can you explain that?
So the reason TB is called a silent killer is because of two reasons. So the first one is that umuntu angaphila nalo legciwane for a very long time, even up to a year, ungena any symptoms. So ayikho into ekhombisayo ukuthi kunokugula lokho khona. So that's one of the reasons it's called a silent killer. The other reason is that it mimics a lot of other conditions. Njengoba dusho wena ukuthi they were checking your lungs ukuthi is it TB or is it pneumonia, because sometimes TB might look like pneumonia, it might look like something else or another condition, but it's actually not that particular condition, and it's actually TB. So then your treatment start is then delayed. So that's why it's called a silent killer. So that's why it's very important uti we should always get screened for TB. We should always get tested for TB. And even for AMA clinicians, you should think of TB every time uhlangana ne client in a facility. Even if as a person at home, ungakhwehlela, ungaba na anything, you must think of TB and you must get tested.